Alright, so this is my next one explaining this. The last video was a little longer. I'm going to try to make this one a little shorter even though we got longer definitions. So this one's a remake for the quiz for the abdomen and thorax injuries. Along with this one, actually, is this one right here. They have pretty much like some of the same things, so I'm going to go over these two real quick. This goes for the ab, thorax, blood, and shock, is what this one's under for the quiz. So we're already going to start right here with the abdominal muscle strains. Abdominal, I'm already thinking like where the stomach is, the abdomen. So we're going to jump right here. It's going to be an injury to one of the muscles of the abdominal wall. Off the bat, I'm going to match up abdominal and abdominal wall right here. And then I'm going to look for a muscle. So we're going to come back commonly, the rectus abdominis. Right here, you're already going to have abdomen, so you're already thinking, you know, they're already going to call out some muscles. And it's also known as a pull abdominal muscle. So just in case you don't know rectus abdominis, you're also going to realize that it's known as an abdominal muscle right here. So that's the way I remember that one. We're going to jump back down to the flow to the solar plexus. And that's going to be a transitionary paralysis of the diaphragm after an impact to the sympathetic celiac plexus, also known as getting the wind knocked out. So right here, for some reason, when I think of blow, I'm going to think of wind knocked out. That's the way I think of mnemonics right here. There's really not that much to it in my mind. Whenever I have blow and then I have to just remember solar and plexus, it's going to have to deal with the wind knocked out of you. And they're just going to use a whole bunch of fancy words when it comes to sympathetic celiac plexus, also known as getting the wind knocked out. So you can either remember the two plexuses right here. This one has to do with solar plexus, and this one has to do with sympathetic celiac plexus. You can remember that, or you can remember the blow to the wind knocked out. We're going to jump back down here, the contusions of the abdominal wall. Contusions, you're already going to have that word. You're going to think of it. It's going to be a contusion. So it's going to be some type of injury, you know, something's happening right there. And you're going to think of abdominal wall. So you're going to look for two things. You're going to look for a contusion keyword, and you're going to look for something with the word abdomen or abdominal wall or something in it, just like this one right here. So right here, compression to me is having to deal with the contusion because, you know, it's going to be up against forces right here. The superficially injure the abdominal skin. Off the bat, you're going to have abdominal. So contusions, you're going to remember compression. Abdominal, you're going to remember abdominal skin. This is the abdominal wall. This is abdominal skin. That's how I'm going to remember that. Those are my mnemonics for that one. You're going to jump back down to heat contusions. It's going to come out as may occur when heat is compressed. Off the bat, heart contusions. I'm so sorry. I was reading back up here right here. Heart contusions. Off the bat, you're going to see the word heart. You're going to try to look for the word heart. You have the word contusions again. You know what that's going to mean. It's going to mean compressed, just like right here, compressed. So you're going to have compressed right here, contusion, and heart contusion. So may occur when the heart is compressed. Off the bat, they're already giving you heart contusion in there. They're just wording it different. So that's the way I'm going to look at it. And then everything that comes after, it's going to say where. Between the sternum, spine, and by strong outside force. Outside force is already going to have to deal with contusion as well. So, you know, that's really going to help you in this case. We're going to jump back down to heart murmur right here. It's going to be labeled as an abdominal periodic sound that occurs in a auscultation, right, of the heart. Off the bat, heart, murmur. Whenever I think of murmur, I think of you know, when somebody's listening to you and they're like and you can just hear it. You hear the sound and you're just like, why does it sound like that? When doctors, when they're checking out, you know, hearts, if they hear a murmur, they think, why is it sounding like that? So off the bat, murmur, I'm going to match with the word sound right here. That's going to be my mnemonic, and the word heart is going to be at the end. So if I'm reading this paragraph, if I'm reading this definition, see the word sound, jump back down here, see the word heart, I'm going to know. It's going to have to deal with the heart murmur. There's not really going to be any other sounds or any other words that have to deal with sound and heart. You know, it's usually just going to be heart murmur. That's all we learned so far in this class. So then we're going to jump back down to hernia right here. Here's the word. Protrusion, protrusion, of abdominal viscera. I have trouble explaining, intestines, which is that it's just explaining the intestines, through a portion of the abdominal wall. To me, I used to watch Grey's Anatomy. They used to talk about hernias, and the first thing that they do was, what would they do? Check the abdomen. They'd always ask, can I check the abdomen? Can I check the abdomen? So for me, this wasn't really a mnemonic within the definition, but I just remember that whenever they're checking your abdomen, they're usually trying to check your intestines. They're trying to see if something's hurting. Usually means inflammation within your intestines. So I'm going to think of hernia when I read this. They already give you abdominal. They give you abdominal two times. So, that's going to be right where, like, the hernia will be. That's the way I remember it through Grey's Anatomy. We're going to jump back down here. We're going to have hyperventilation. Off the bat, when I think of ventilation, I'm thinking of a type of breathing, or like, there's going to be ventilation somewhere. Hyper, I think of crazy, like a crazy amount, like the ride X2 at Six Flags. I think it's crazy. It's hyper, So I'm already off the bat thinking of like crazy air. That's what I'm thinking. And we jump right here to the definition. It's going to be a patient who has excessively rapid rate of ventilation, usually due to anxiety-induced stress or asthma, gradually develops a decreased amount of carbon dioxide in the blood. So you're reading this and you got to break it down. So you got to break it down right here. They're already giving the word ventilation. Boom, you can match that right there. And excessively, before you skip that, just like hyper, like we're talking about, it was rapid, it was crazy. So off the bat, they're already giving you excessively ventilation. Hyperventilation right here, they already gave you, again, just like over here that they were wording it differently, they're doing the same thing. So as long as you start to read it and you see excessively rapid rate of ventilation, you're going to think of hyperventilation. Because then right here, the rest of the definition, it's just going to tell you what it's due to and what happens after, and then, carbon dioxide in the blood, anxiety-induced stress, where it's from, and then what happens. But it already gives you right here the two key words. That's what you're going to use. You're going to jump back down to kidney contusion right here. On contusion, we have the word again. You're going to think of compressed automatically. So you're going to read the definition. It's going to say an injury resulting from an external force, usually one applied to the patient's back, causes abdominal extension of an engorged kidney. Off the bat, look, they already gave you it. They gave you kidney right here. Okay? They gave you kidney. They give you kidney at the end of this. For some reason, mnemonics really, really help me. Just like over here, they're going to give you external force. That already means compression. So you're reading this and you're reading external force, you're going to think of a compression. It's going to tell you, usually one applied to the patient's back. That's already giving you the location. And it causes an abnormal extension of an engorged kidney. So automatically, if you remember, if somebody gets hit here, what's going to happen or what is it going to affect? So this is just one of the things you really got to memorize, that, if it hits the patient's back,